Welcome to SWAM NPTEL course on food microbiology for safe and sustainable food systems. We were discussing diseases caused by food-borne microorganisms. In this lecture, we will be discussing food-borne diseases and food safety in India. And we will include in this chapter introduction, food-borne diseases in India, food-borne illness of infectious origin, food-borne transmission of pathogens and toxins, steps of outbreak investigation, prevention. Food-borne diseases including food-borne intoxications and food-borne infections are terms applied to illnesses acquired through consumption of contaminated food and are also frequently referred to as food poisoning. Worldwide, food-borne diseases are a major health burden leading to high morbidity and mortality. The global burden of infectious diarrhea involves 3 to 5 billion cases and nearly 1.5 million deaths annually, mainly in young children due to diarrheal disease caused by contaminated food and water. The World Health Organization Southeast Asia region has a quarter of the world's population. Diarrheal diseases continue to be one of the top 3 leading causes of disability adjusted life year losses. It has the second highest burden of food-borne diseases per population among WHO regions. While many food-borne diseases may be self-limiting, some can be very serious and can lead to death, particularly in children, pregnant women and older persons. The World Health Organization Southeast Asia region contributes to 1/3 of the global deaths due to diarrhea in children under 5 years of age. Food-borne disease outbreaks are defined as the occurrence of 2 or more cases of a similar illness resulting from ingestion of a common food or observed number of cases of a particular disease exceeds the expected number. These can be confirmed when at least one causal agent is identified or suspected that based on clinical and epidemiological information. Although most cases are sporadic, these diseases draw attention to themselves due to outbreaks through thorough investigation of which can help in identifying control measures. Food-borne diseases in India. In India, the burden of food-borne disease is not known. Most food-borne diseases go unreported. Only few are reported by the media, usually those with high morbidity and are occurring in urban areas. The Integrated Disease Surveillance Program, that is IDSP network, was launched in India in 2004. Aggregate analysis of IDSP data from 2011 to 2015 shows food-borne outbreaks together with acute diarrheal diseases constitute nearly half of all reported outbreaks under IDSP for the period 2011 to 2016. However, for food-borne illnesses, passive surveillance system only represent the tip of the iceberg because most patients have mild symptoms of short duration and do not seek medical care. Many of those that do access clinical care will not have the laboratory test performed to determine a specific etiology, and of those who seek medical care in whom an etiology diagnosis is confirmed, not all will be reported to the surveillance systems. The foodborne diseases in India are expected to rise from 100 million in 2011 to 150 to 177 million in 2030. By 2030, 1 out of 9 people will fall sick as compared to 1 out of 12 in 2011. A foodborne illness of infectious origin. The pathogenic organisms transmitted through contaminated foods are bacteria, viruses, protozoa, and helminths. Foods that are contaminated may not look, taste, or smell any different from foods that are safe to eat. Salmonella is the most common cause of foodborne illnesses. Listeria monocytogenes can even grow inside the refrigerator in ready to eat food. Staphylococcus aureus bacteria can grow in food and produce toxins that cause staphylococcal food poisoning. Cholera, although primarily a waterborne disease, may have a food source if contaminated water is used. Different foods implicated in foodborne outbreaks in India are milk and milk products such as dahi, khoa, buttermilk, sweets, kheer, meat, poultry, fish, fowl, seafood such as prawns, cooked and uncooked rice, samosa, batata vada, tamarind, and cooked as well as uncooked vegetables. A survey of egg cells, egg trays, and egg contents in Coimbatore showed 7.7x and 7.7% eggs and 7.5% egg trays were contaminated with Salmonella. The most common serotype was Salmonella enteritidis. Worldwide foodborne illness figure prominently among emerging and re-emerging diseases discovered in the last few decades. They include Campylobacteriosis, Cyclosporidium, Cryptosporidiosis, enterohemorrhagic E. coli infections, Listeriosis, and Yersiniosis. These microbes have animal reservoirs and are associated with consumption of foods of animal origin. Contact with contaminated soil and infected animals. In addition, there are new strains of Vibrio cholera and drug resistant strains of enteric pathogens such as Salmonella and possibly Helicobacter pylori. Viral agents being host specific, their transmission through humans through food of animal origin is rare. Mycotoxins are a group of naturally occurring chemicals produced by certain molds and fungi. They can grow on a variety of different crops and foodstuffs including cereals, nuts, spices, and dried fruits. Mycotoxins are produced by several fungi in foodstuffs, and these feed during production, storage and transportation, often under warm and humid conditions. Mycotoxins such as aflatoxins, ochratoxin A, fumonisins, trichothecenes, ergot alkaloids and zearalenone are of public health importance. In India, moldy maize, sorghum and wheat flour are associated with outbreaks of mycotoxicosis. Food poisoning from consumption of poisonous wild mushrooms has been reported frequently, particularly in the monsoon season. The majority of fatal mushroom poisoning occurs due to ingestion of Amanita phalloides, the death cap due to its high content of amatoxin, which is a potent cytotoxin. In India, atropine food poisoning from accidental consumption of Atropa acuminata plant leaf has also been reported from a military garrison. Chemical food poisoning can also occur through adulteration of food by adding prohibited substances to partly or wholly substitute healthy ingredients or to artificially create the impression of freshness in stale food. Adulterants may be in solid form, chemicals or liquids and made up of coloring substances. The infectious versus intoxications. The infectious diseases are caused by bacteria, viruses or parasites, whereas intoxication is caused by the toxins produced by these organisms. The mechanism is invade and or multiply within the lining of the intestine, invade and or multiply within the lining of the intestines where there is no invasion or the multiplication in the intestine. The incubation period for the infectious type microorganisms is from hours to days, whereas for intoxications it is from minutes to hours. The symptoms of infections are diarrhea, nausea or vomiting, abdominal cramps with or without fever, whereas for intoxication the symptoms include vomiting, nausea, diarrhea, double vision, weakness, respiratory failure, numbness, sensory and motor dysfunction. The transmission of infectious type disease can be spread from person to person via the fecal-oral route, whereas the intoxication is not communicable. The factors related to food contamination includes inadequate cooking, cross contamination, poor personal hygiene, bare hand contact, whereas for the intoxications, inadequate cooking, improper holding temperatures, etc. These are reported foodborne outbreaks due to bacteria in India during 1980 to 2016. These are the places like party, mess, homes, feast, religious ceremony, military establishments, marriage party, school, hostel, educational institutions, hospital, slum area, tea gardens, funeral receptions. There are incidences of varying nature, and the number of affected persons are also vary, and the mostly microorganisms that are involved in this type of food poisoning are Salmonella, Vibrio, E. coli, Yersinia and Shigella species mostly. Food-borne transmission of pathogens and toxins. Food may become contaminated during food production and processing, or during food preparation and handling, or during storage. Food production and processing. Foods such as fruits and vegetables may be contaminated if washed or irrigated with water that is contaminated with pathogens from animal or human feces. Animals naturally harbor many foodborne bacteria in their intestines that can cause illness in humans, but often do not cause illness in the animals. During slaughter, meat and poultry carcasses can become contaminated if they are exposed to small amounts of intestinal contents. Food preparation and handling. Infected individuals. Most food-borne pathogens are shed in the feces of infected persons, and these pathogens may be transferred to others through food via the fecal oral route. Bacteria present in infected lesions and normal nasal flora may also be transmitted from an infected food handler to ready to eat foods. Cross contamination. Pathogens naturally present in one food may be transferred to other foods during food preparation if same cooking equipment and utensils are used without washing and disinfecting in between, especially in case of ready to eat foods. Inadequate cooking temperature. With insufficient cooking, bacteria can multiply and produce toxins within the food. Many bacterial toxins are heat stable and may not be destroyed by cooking. Improper storage. Food being held or stored at warm temperature, that is 10 to 50 degrees Celsius, allows multiplication of pathogens and is an important cause of foodborne outbreaks. It is essential to have a high index of suspicion for foodborne illnesses for better evaluation and management of these cases. During the initial assessment of patients with suspected foodborne illness, the critical history is very important. The time of onset, that is incubation period, duration of illness, clinical symptoms, history of recent travel or antibiotic use, as well as presence of blood or mucus in the stool, recent meals including type of food, especially raw or uncooked food, unpasteurized milk or food products, cooking and refrigeration, as well as details of others affected by similar symptoms can provide valuable clues to the etiology. Types of bacterial food poisoning. The non-inflammatory, it is located in the proximal small intestine, and the illness cause is watery diarrhea, and the microscopic examination of stool shows no fecal leukocytes, and it is caused by various microorganisms which include Vibrio cholera, different types of E. coli, Clostridium perfringens, Bacillus cereus, Staphylococcus aureus, rotavirus, norovirus, enteric adenoviruses, Giardia lamblia, Cryptosporidium, Cyclospora, Microsporidia. The inflammatory invasion or the cytotoxin, it is caused in the colon or distal small intestine, and the illness cause is dysentery or inflammatory diarrhea, and the microscopic examination of stool shows the PMN fecal leukocytes, and it is caused by various organisms like the Shigella, Salmonella, etc. Whereas the penetrating type is found in the distal small intestine, and the illness cause is enteric fever, and the microscopic examination of stool shows mononuclear fecal leukocytes, and it is caused by Salmonella typhi, Yersinia enterocolitica, Campylobacter fetus, etc. The bacterial food poisoning, that is incubation period, is different for different things, like 1 to 6 hours is for Staphylococcus aureus, Staphylococcus aureus, Staphylococcus aureus, and it causes nausea, vomiting, diarrhea, and the foods generally responsible for this spread is ham, poultry, potato, egg salad, mayonnaise, cream pastries, etc. The Bacillus cereus, the incubation period is same, that is 1 to 6 hours, and it causes nausea, vomiting and diarrhea, and fried rice is the important tool for the spread. The Clostridium perfringens and Bacillus cereus, the incubation period varies from 8 to 16 hours, and it causes abdominal cramps, diarrhea, vomiting is rare, and it is spread by beef, poultry, legumes, gravies, meats, vegetables, dried beans, cereals, etc. The incubation period is more than 16 hours for the Vibrio cholera, different types of E. coli, that is enterotoxicating Escherichia coli, enterohemorrhagic Escherichia coli, Salmonella species, Campylobacter jejuni, Shigella species, and Vibrio parahemolyticus. And these are the symptoms like watery diarrhea, bloody diarrhea, inflammatory diarrhea, and dysentery, and this is generally spread by these food items, which include shellfish, salad, cheese, meats, water, beef, salami, raw milk, vegetables, apple juice, etc. Steps of outbreak investigation. Establish existence of an outbreak. Detailed baseline epidemiological information should be collected as soon as possible, which includes but is not limited to the following: information about the persons reporting the potential outbreak, number of persons suffering from the illness, date and time of consumption of food and onset of illness for each ill person, specific symptoms experienced, presumptive diagnosis, total number of persons exposed or not exposed, both ill and not ill, location where food was prepared and eaten, specific food item or drink consumed including ice, other commonalities including other shared meals or activities, number of stool samples collected for testing, additional information including specific activities and medications taken before the onset of illness. Now, coordination with key personnel. A successful investigation requires a teamwork approach and collaboration among, but not limited to, medical investigators, epidemiologists, food inspectors, microbiologists, and health care providers. collection and transport of clinical specimens and food samples for laboratory testing. For most foodborne disease outbreaks, food and stool samples have to be collected from persons experiencing diarrhea to identify or confirm the pathogen. Blood cultures or serological testing are recommended for systematic infections such as enteric fever, listeriosis or viral hepatitis, although serology has a limited role for most other foodborne illnesses. Stool collection should be encouraged whenever a person is experiencing or has recently experienced a diarrheal illness. If possible, requests for stool samples should begin during the initial foodborne illness report and may continue during the outbreak investigation. Implementation of control and preventive measures. Usually, most of these outbreaks are self-limiting. Precautions and prevention are aimed at preventing future outbreaks. Investigators should respond and implement appropriate public health action as soon as possible, including but should not be limited to the following: removal of contaminated food, exclusion and restriction of persons who are at high risk of spreading illness, including food handlers, day care attendees and providers, and persons involved with direct patient care. Emphasizing hand hygiene and closing the food establishment if implicated. Definition of cases, population at risk and finding cases. Primarily, information obtained during the early stages of an outbreak investigation can be organized using a line list. A case definition in the setting of an outbreak investigation usually includes 4 criteria, that is clinical information and information related to time, place and person. A case definition should be developed for every outbreak to ensure that ill persons are classified appropriately. Good case definitions often include simple and objective clinical criteria, for example, diarrhea, which is defined as 3 or more loose stools in a 24 hours period with vomiting or nausea. The population at risk provides the denominator base on which various attack rates can be calculated. Description of epidemiology in time, place and person. Tools that may be used to organize and depict the outbreak by time, place and person include epidemic curves, maps and frequency tables. Development of possible hypothesis. Develop a hypothesis as an educated guess about the cause of the outbreak and the factors that may have contributed to the illness. Planning and conducting an epidemiological study to evaluate the hypothesis. The questionnaire and the study design are important tools used to further analyze the outbreak and make comparisons between those affected and not affected by the outbreak. Analysis of the data collected and interpretation of results. Important tasks that should be performed to finalize the data include the following: re-evaluate the case definition and ensure all cases meet the case definition. Update previously plotted epidemic curves. Calculate frequencies and percentages. Compute the median and ranges for the incubation period and recovery period. In a retrospective cohort study, calculate the attack rate, food specific attack rates, and relative risk ratios. If the study design was a case control study, calculate the odds ratios. Determine if results obtained are statistically significant, for example 95% confidence intervals. Reporting the findings of the outbreak investigation. Documentation is extremely important as a written record of the public health rationale for the activities as well as the findings of the investigation. A written report provides a record of performance, provides an account of the outbreak for potential medico-legal issues, and can improve the quality of future investigations. Prepare and write the report following a scientific format which includes introduction, background, methods, results, discussion, recommendations, and supporting documents. A preliminary or summary report should be prepared and disseminated until the final report is completed. Now, prevention. Food safety is an area of public health action to protect consumers from the risks of food poisoning and foodborne diseases, acute or chronic. Food safety is a continuum with its scope extending from farm to plate. The globalization of food trade has increased the potential to rapidly spread foodborne hazards around the world. Food production today is more complex, from its raw state through processing and shipping to consumption by the consumer. Food can get contaminated at any stage. An error by a food producer in one country can affect the health of consumers on the other side of the planet. In our globalized world, foods travel far and fast. The health risks impact the whole food supply chain, starting from input supply to the farm to the consumer table. Key strategies to ensure food safety include having a clear food safety policy and regulations which can be uniformly enforced in an uncomplicated manner, effective surveillance system for foodborne diseases linked to a food safety disease information, food safety database information system, food control and inspection system with analytic capacity and adoption of quality assurance systems by the food business operators and food industry, such as hazard analysis and critical control points, which is recognized by the Codex Alimentarius Commission as the most cost effective approach for food safety at all stages of the food supply system. HACCP is a systematic preventive approach to food safety that addresses physical, chemical, and biological hazards as a means of prevention rather than finished product inspection. HACCP is used in the food industry to identify potential food safety hazards so that key actions can be taken at these critical control points. The system is used in the food industry at all stages of food production and preparation processes, including packaging, distribution, etc. HACCP is an effective approach to food safety and protecting public health. Apart from food contamination, transmission of infection occurs by direct contact favored by the habits and customs of people. Improper storage and handling of cooked food is equally responsible for foodborne illnesses, as during storage especially at ambient temperatures, that is 28 to 38 degrees Celsius, there is higher risk of multiplication of pathogenic organisms. Food safety education is a critical prerequisite to prevent foodborne outbreaks by education of food handlers and the community about proper practices in cooking and storage of food and personal hygiene. Hand washing is one of the key interventions, not just by food handlers but also by the community at large. Environmental measures including discouraging sewage farming for growing vegetables and fruits. That's all for today. Thank you very much.